Louis Carew, and over the next few days I'll be delving into the fascinating and controversial world that involves over-medication, children who are distracted, and parents who are overwhelmed and feel like there is a loss. I'm going to be talking about attention deficit hyperactivity disorder. Some of you know this as ADHD.
So, I'm coming to see Dr. Andre Young. He's a medical expert in the field of ADHD. Andre.
Good afternoon, Louis.
Good afternoon. Shall we take a seat?
Yeah.
Let's get this started then.
So, Louis,
What exactly is attention deficit hyperactivity disorder?
well, that's a good question, Louis. I would like to probably start off with a definition and say that ADHD, as it's more commonly known as a lifetime disorder, where symptoms consist of overactive behaviour and a short attention span as well as poor concentration.
That's very good, very interesting.
The treatment for this depends heavily on which country you're in, as some like to use a large amount of a drug called Ritalin, while other countries prefer to use therapy to control children with ADHD.
So you mentioned a lot about treatment in other countries there. What about treatment here in the United Kingdom?
Treatment here in the United Kingdom is varied. It depends on cases, but more widely we have a dual approach where we subscribe Ritalin but combine it with alternative cognitive behavioural therapy.
Oh, that's very interesting. So Andre, what is the aim of these drugs?
Well, the most commonly used drug, Ritalin, is primarily used as a stimulant. It helps children increase activity in their brain, which particularly plays a vital role in controlling their attention and their behaviour.
Oh. So what are the side effects of these drugs that you're prescribing these children?
Well, Louis, there are side effects, as with any medication. Consistent with Ritalin are headaches, nauseousness, vomiting, mood swings, loss of appetite. In extreme cases, we prescribe a drug called lexidephamine. It can cause drowsiness and blissfulness in children, but we tend not to use that as much. But their studies have shown that they do have dramatic effects in calming children down, especially with other children, such as when in school, where they can be very disruptive.
These children who have become drowsy and blissful because of this drug, are they not having a good quality education now because they're not paying attention?
Well, that is true to an extent. If I'm providing a treatment for a child with ADHD, I believe it's the best treatment for them, and if it's going to help with their progression in school, I think it's the best solution.
Okay, thank you very much for being very enlightening.
Thank you, Louis.
Nice to meet you.
So at the moment I'm off to see Davina Webster. She is the treasurer of the educational psychologists. Oh, she's here early already. Hi, Davina.
Hi, please come
Hope you haven't been waiting. What's your association's involvement with the prescription of Ritalin?
Well, we've previously lobbied the Department of Health for over-prescribing Ritalin to children with ADHD. We think it shouldn't be the first port of call. There are other methods to treat children with their condition.
Oh, okay. What are these other methods that you believe in?
Well, there's family therapies, because obviously the parents do need to be involved, and another one we found to be very successful is cognitive behavioural therapy.
Do you think there's a difference between the use of Ritalin in the US and here in the United Kingdom?
Yeah, I think it's quite commonly known that it's much more common in the US than it is in the UK. However, I think the numbers are rising in the UK, which the association isn't overly happy with. There was recently a study in Colorado where 150 participants were given a placebo drug and cognitive behavioural therapy, and the other 150 were given Ritalin and cognitive behavioural therapy. The results showed that the Group A successfully managed to reduce their symptoms just as well as Group B. So do we really need to use Ritalin in all cases?
So what you're saying is Ritalin shouldn't be used as often as it is, but to help children in education.
Certainly. I think there are other methods that come without the terrible side effects that Ritalin can give.
Do you think Ritalin's been used as a quick fix to help these children in schools?
I definitely think it's been used as a quick fix. There's been cases where Ritalin has been prescribed to children as young as 3 and in mild to moderate cases, which goes against NICE guidelines.
Oh, that's very interesting. Excellent to meet you.
Excellent to meet you, Louis.
Lovely, thank you very much. Farewell. So, I'm off to see Shaniqua and Terence. Terence is Shaniqua's little boy who's in school currently and has ADHD. So I'm going to find out their perspectives on the medication.
Oh, hello, Louis.
Shaniqua?
Yes, please come in.
Lovely to meet you, thank you very much. Shall we go and find little Terence?
Yes, after you.
Thank you. Hello, you and Terence. Hello.
Louis, can I get you anything?
I'd love a good cup of tea, Shaniqua. Thanks. So, Terence, how does the medicine you take make you feel? Do the other children know about it?
Well, every day a new child gets registered and it says Ritalin next to my name, but they don't know what it's for or why I take it, but they know that I take it. And it makes me feel a bit left out.
And Shanae, how did the prescription of Ritalin affect you? Is there any further ramifications?
Well, it made me feel a little bit vulnerable, to be honest. We live in a society and an age where we have to follow cultural and social norms, where things like behaviour, appearance, all filter into our everyday lives. Women in the past have generally had things like Prozac or cosmetic surgery to help them through. Now I have Ritalin to help me with Terence.
Oh, thank you. So, what was Terence's behaviour like before the medication?
It was awful. He had terrible mood swings, poor concentration, he had uncontrollable impulsive behaviour. I thought it was something at school. I mean, it's not my fault. There's nothing wrong with my boy.
I understand that, okay. So what was Terence's behaviour like after the medication?
Well, initially I found that he began to lose his appetite. He started to say that, complaining that everything tasted funny, and he subsequently lost some weight. However though, as far as his schoolwork was concerned, it improved dramatically. His handwriting was like a different child's. He came back with no bite marks on his book or tears or scribbles or anything like that. It was much, much better.
That's good. So, Shaniqua, do you ever feel like you're being judged and shunned by other parents at school ever since Terence was put on Ritalin?
Honestly, yes. We began to feel that we were being shunned at the school gate. Obviously that then made me feel quite anxious, a bit guilty and sometimes even angry with Terence's condition. I think it's important that we try to remember that when Terence goes to school, that, and indeed with any child who has similar issues to Terence, that as a parent you work cooperatively with teachers and the Parents' Council at whatever school that they go to.
Oh, that's very interesting. Very nice to meet you, Shaniqua.
Bye.
So, I've had a very interesting couple of days. I've learnt about Ritalin and where it should be used and how, and to be honest, I think that it should be used in some cases. Not all the children need it, but some, in the extreme cases, should be medicated. And that's it. That's been Louis Theroux on ADHD. Bye.